I'm Sze Lee. I'm an obstetrician at Epworth Freemasons. I've been looking after women and their babies for almost 20 years. Each pregnancy is special, and I've been really privileged to be along on the journey with women as they have their babies. As you're getting towards the end of your pregnancy and hopefully looking to come into labor and have your baby, there are a few things that you need to be on the lookout for. The first one are contractions. Women ask what contractions are like. They're painful. They feel like period pains, and they last anything from about 30 to 60 seconds. It will take your breath away, stop you in your tracks, but it won't last for more than a minute. When they're coming every 5 minutes, and you get about 10 or 12 of them in a row, so for about an hour or so, you should probably call the hospital. The second thing to look out for would be if you rupture your membranes. So if the bag of fluid around the baby breaks, so a big gush of fluid running down your legs, you need to call the hospital. The third thing I would look out for would be if you have any bleeding. Bleeding in pregnancy is never normal. Please call the hospital. And finally, if you are concerned about your baby or about anything at all, please remember there is always someone in birth suite 24 hours a day. It is better you call and reassure yourself rather than sit at home and be concerned and worry. When you first start having contractions, they can be quite spaced out. So some women have contractions that come every 15 to 20 minutes, and if you do, then do call the hospital, but we will likely tell you to keep yourself comfortable, maybe take some Panadol, and when they become a bit more frequent and they come every 5 minutes or so, then please come in. So when you're getting contractions at home and they're lasting every 15 to 20 minutes, that's still in a very, very early stage of labor, and you may be more comfortable at home. The first thing I would talk about is maybe getting into a hot bath or a hot shower, because you find that that often does ease it. Panadol is perfectly safe in labor. Something else you could do is if you have a fit ball, you could just find yourself sitting on the fit ball because it's softer on your pelvis as you labor, and just rocking on the fit ball, and essentially just keeping yourself as comfortable as you can in whatever position that you're able to cope with. Particularly if it's your first labor, we don't expect you to know all the answers. We don't expect you to know where I am in labor, when I come in. So please remember there is always someone in birth suite 24 hours a day. Give them a call if you're not sure. We'll ask you a series of questions and we can tell you what to do. We can tell you when to come in or to suggest something for pain. We'll work it out together.